Every year, approximately 60,000 Americans are newly diagnosed with Parkinson's disease. Worldwide, that number reaches 10 million. But here's what terrifies me most as a neurologist. The vast majority of these people experienced warning signs for months, sometimes years, before they were actually diagnosed. They felt symptoms. They noticed changes, but they didn't recognize these changes as Parkinson's. Their doctors didn't recognize them, and by the time diagnosis finally came, the disease had already progressed significantly. The window for early intervention had narrowed. But what if you could recognize Parkinson's earlier? What if you could identify the 8 early warning signs before they become obvious motor symptoms? What if you could start treatment years earlier, dramatically altering the trajectory of your disease and preserving your quality of life? I'm Dr. William. I've spent over 2 decades diagnosing and treating Parkinson's disease patients. And today I'm revealing the 8 early warning signs of Parkinson's that almost nobody recognizes. Some of these signs don't involve shaking or movement at all. Some appear a decade or more before the typical Parkinson's symptoms that everyone knows about. And if you recognize these signs early, if you seek diagnosis and start treatment, your life can be profoundly different from someone who waits years for diagnosis. Stay with me until the end, because warning sign number 4 is one of the most overlooked early indicators, yet it affects millions of seniors right now, and almost nobody connects it to Parkinson's disease. Let me explain what Parkinson's disease actually is, because most people have fundamental misconceptions. Parkinson's is a progressive neurological disease that affects movement, cognition, mood, and autonomic function. It's caused by the death of dopamine-producing neurons in a part of the brain called the substantia nigra. Dopamine is a critical neurotransmitter that controls movement, mood, motivation, and numerous other functions. When these neurons die, dopamine production drops, and Parkinson's symptoms emerge. Now here's what's critical to understand. Parkinson's doesn't suddenly appear. It develops over decades. Pathological changes in the brain, the accumulation of misfolded proteins, the loss of neurons. These begin 20, 30, sometimes 40 years before motor symptoms become obvious. During this preclinical phase, subtle signs emerge: loss of smell, sleep disturbances, mood changes, constipation. These are your nervous system signaling that something is wrong. But most people miss these signals. Most doctors miss these signals. And by the time motor symptoms appear, tremor, slowness, rigidity, significant neurological damage has already occurred. But here's the hope. If you recognize early warning signs, if you seek neurological evaluation, if you get diagnosed, early treatment can dramatically slow disease progression. Dopamine replacement therapy, neuroprotective agents, physical therapy, cognitive stimulation. These interventions work best when started early. Early treatment can slow progression by 50% or more. Early treatment preserves quality of life independence, cognitive function for years longer than late treatment. The difference between early diagnosis and late diagnosis is often the difference between preserving independence and requiring a caregiver, between maintaining cognitive function and experiencing dementia, between living well and suffering severely. That's why recognizing these 8 early warning signs is so critical. I'm Dr. William. I completed my neurology training at major academic medical centers. I've spent over 2 decades specializing in movement disorders, particularly Parkinson's disease. I've worked with thousands of Parkinson's patients, some diagnosed early, when they still had many years of functional life ahead, some diagnosed late when disease was already significantly advanced. The difference is profound. I've reviewed the latest Parkinson's disease research. I've studied the early markers and precursors of the disease. I've seen firsthand what a difference early diagnosis and early treatment makes in a patient's life trajectory. And I'm here to share this knowledge because every senior deserves to know these warning signs. Every senior deserves the opportunity for early diagnosis. Every senior deserves the chance to modify their disease course through early intervention. Let's start with the most well-known symptom of Parkinson's disease, tremor. But here's what most people don't understand. The tremor of Parkinson's is very specific. It's a resting tremor. That means the shaking occurs when your hand is at rest, not when you're actively moving or using your hand. It typically starts in one hand, often the dominant hand, and has a characteristic pattern. Your thumb and fingers move in a rhythmic pill-rolling motion, as if you're rolling a small pill between your thumb and fingers. This resting tremor is different from other types of tremors. Anxiety tremor disappears when you rest. Essential tremor appears with movement, but Parkinson's tremor appears at rest and often decreases with intentional movement. Now, why is Parkinson's tremor so commonly missed? Because people attribute it to other causes. Oh, I'm just stressed, they say. I'm drinking too much coffee. I'm getting older, my hands are just shaky. I probably have anxiety. They don't think Parkinson's disease. And sometimes their doctors don't think Parkinson's either, especially early on when the tremor is subtle. I had a patient, Robert, 68 years old. He noticed a slight tremor in his right hand, just a subtle shaking. He mentioned it to his primary care doctor, who said probably nothing might be caffeine or stress. Robert accepted this. He didn't pursue it further. 3 years later, the tremor had worsened significantly. He was experiencing slowness of movement, stiffness, difficulty with fine motor tasks. He went back to his doctor. MRI and neurological exam confirmed Parkinson's disease. Had he been referred to neurology at the initial tremor, had he been diagnosed 3 years earlier, early dopamine replacement therapy could have been started. Disease progression could have been slowed. 3 years of early treatment might have meant 3 additional years of independence and quality of life. So here's what you should know. If you develop a resting tremor shaking that appears when your hand is relaxed, that's rhythmic, that persists for weeks or months, this warrants medical evaluation. Mention it to your doctor. Request a neurology referral if your primary care doctor isn't sure. Don't dismiss it as stress or caffeine. Don't wait for other symptoms to appear. Tremor at rest should prompt Parkinson's screening. But the next warning sign appears even earlier than tremor, and almost nobody recognizes it as significant. This is a warning sign that fascinates me because it's so specific to Parkinson's, yet so commonly overlooked. Micrographia means your handwriting gets progressively smaller, your letters shrink, your words become more cramped, writing becomes harder, smaller, slower. It's not arthritis, it's not just your handwriting changing with age, it's a specific symptom of Parkinson's reflecting the disease's effect on fine motor control. Why is this so completely missed? Because people don't pay attention to their handwriting. They don't compare their current handwriting to their handwriting from a year ago. They don't recognize the pattern as significant. They might notice it, my handwriting's getting worse, and think, well, I'm getting older. But they don't connect it to neurological disease. And most doctors never ask about handwriting changes. It's not part of the standard medical evaluation. But research shows that micrographia can appear years before other Parkinson's symptoms become obvious. It can be one of the earliest signs. I had a patient, Margaret, 70 years old. Her daughter noticed that her mother's handwriting was noticeably smaller than it used to be. Margaret's signature on checks, which had been large and flowing, had become tiny and cramped. She was struggling to write. Her handwriting was difficult to read. Margaret mentioned it to her doctor, who didn't think it was significant. But Margaret's daughter, who happened to be a nurse, suggested that handwriting changes could indicate Parkinson's. Margaret sought neurology evaluation. Neurological exam confirmed early Parkinson's disease. Early diagnosis, early treatment started. The handwriting change that everyone had overlooked was actually the earliest sign of her disease. So here's what you should do. Look at your handwriting. Compare your current handwriting to samples from a year ago, 2 years ago. Has your handwriting noticeably shrunk? Are your letters smaller? Is writing becoming harder? If yes, this warrants medical evaluation. Mention it to your doctor, show them the comparison, request neurology referral. This is an important early sign, but the next warning sign affects your sleep, and it's so specific to Parkinson's that it's actually a strong predictor of disease development. This warning sign is remarkable because it's actually one of the best predictors of Parkinson's development, yet almost nobody knows about it. REM, sleep behavior disorder, or RBD, means you're acting out your dreams during sleep. You're thrashing around, you're hitting your bed partner, you're waking up confused, you're having vivid nightmares that involve movement. This happens during REM sleep, the stage when your brain is supposed to paralyze your muscles so you don't act out dreams. In RBD, that paralysis mechanism fails, so you physically act out your dreams. Now, why is this a Parkinson's warning sign? Because the same neurological pathology that causes Parkinson's, the accumulation of misfolded alpha-synuclein proteins, begins in brain regions that regulate sleep. RBD can be the earliest manifestation of this pathology. Research shows that people with RBD have a 50 to 80% chance of developing Parkinson's or a related neurodegenerative disease within 10 to 15 years. This isn't a guarantee. Not everyone with RBD develops Parkinson's, but the risk is extraordinarily high. Why is this missed? Because sleep disorders are common in older people. People and doctors attribute RBD to nightmares, stress sleep issues, age. They don't think Parkinson's precursor. I had a patient, David, 72 years old. His wife reported that he was kicking violently during sleep, sometimes hitting her, thrashing around, waking up confused and disoriented, not remembering his dreams, but clearly having been moving dramatically. She mentioned it to his doctor, who said he probably just has bad dreams. But David's wife insisted on sleep study. Sleep study confirmed RBD. Given his age and symptom profile, neurology referral was warranted. Neurological exam raised suspicion for early Parkinson's disease, though no motor symptoms were yet obvious. Early diagnosis. Early monitoring and treatment could begin. The sleep disturbances that everyone had dismissed as normal sleep issues were actually the earliest sign of his neurological disease. So here's what you should know. If you or your bed partner notices that you're acting out dreams, thrashing during sleep, hitting, kicking, or waking confused, especially if this is a new development or worsening pattern, this warrants sleep study and neurology evaluation. This is a serious warning sign. Don't dismiss it as normal nightmares or aging. Seek medical evaluation. But the next warning sign is something that's often treated without ever investigating the underlying neurological cause. This warning sign breaks my heart because it's so commonly missed. Depression appearing in a senior without an obvious external cause, no recent loss, no major life stressor is actually a significant Parkinson's disease warning sign. Here's why. Dopamine is critical for mood regulation. In Parkinson's disease, dopamine-producing neurons are dying. This dopamine deficiency affects not just movement, but mood as well. Depression can appear years before motor symptoms. And here's what happens. The senior becomes depressed. They go to their primary care doctor. The doctor says, well, you're retired, maybe you're bored. Or maybe you're experiencing normal aging-related mood changes. They prescribe an antidepressant. The antidepressant provides some benefit, but not complete. The patient accepts this. They think they just have depression. Nobody investigates the underlying neurological cause. Years later, motor symptoms appear. Parkinson's disease diagnosis. The depression that was treated as a primary mood disorder was actually a symptom of Parkinson's disease. Research shows that 40 to 50% of Parkinson's patients experience depression before motor symptoms appear. This is a significant number. It means that unexplained depression in seniors warrants Parkinson's screening, not just antidepressant treatment. I had a patient, Eleanor, 70 years old. She developed significant depression. No obvious cause. Her husband hadn't died. She wasn't having major life crises. She just became deeply depressed, anhedonia, loss of pleasure in activities she used to enjoy, fatigue, low mood. Her doctor prescribed an antidepressant. She experienced partial benefit, but not complete remission. She lived with depression for 2 years, thinking it was just a mood disorder, just part of aging. Then she noticed a tremor in her hand. Neurology referral. Parkinson's disease diagnosis. Once she started dopamine replacement therapy treatment for Parkinson's, her depression actually improved more than the antidepressant had helped. The depression was a symptom of Parkinson's disease, not a primary psychiatric illness. Early diagnosis would have explained the depression, provided better treatment. So here's what you should know. Unexplained depression appearing in a senior, especially if it doesn't respond well to antidepressants, or if it accompanies other symptoms we're discussing, this warrants Parkinson's screening. Don't just treat the depression, investigate the cause. But the next warning sign is so subtle and so commonly overlooked that it's almost universal in early Parkinson's, yet almost nobody recognizes it. Research shows that loss of smell, reduced olfactory function, is one of the earliest warning signs of Parkinson's disease. It can appear 10, 15, even 20 years before motor symptoms become obvious. It's literally the canary in the coal mine for Parkinson's pathology. But almost nobody recognizes it. Why? Because people think it's just aging. I'm getting older, my sense of smell is fading. Or they attribute it to allergies or COVID aftermath. They don't think neurological disease. But loss of smell in Parkinson's is distinctive. It's not just mild reduction. It's noticeable progressive loss of olfactory function. You can't smell food. Coffee has no aroma. Flowers have no scent. Your spouse's cologne or perfume is gone. Food tastes bland because so much of taste is actually smell. Why does Parkinson's cause loss of smell? Because the same alpha-synuclein pathology that damages dopamine neurons also damages olfactory neurons, the neurons that detect smell. This happens early in the disease process. I had a patient, Charles, 65 years old. Over the course of a year, he noticed his sense of smell was fading. Foods tasted bland. Coffee didn't smell like coffee anymore. He couldn't smell his wife's perfume anymore. He attributed it to aging. His doctor didn't think it was significant. 12 years later, he developed motor symptoms, Parkinson's diagnosis. If he'd known that loss of smell at 65 was an early Parkinson's sign, if he'd sought neurological evaluation, if he'd been diagnosed at smell loss, he could have started treatment 12 years earlier. 12 years of early dopamine replacement therapy, neuroprotection symptom management. His disease progression could have been dramatically altered. So here's what you should know. If your sense of smell noticeably diminishes, especially if it's progressive over weeks or months, not just occasional, mention it to your doctor. Ask specifically about Parkinson's screening. Loss of smell warrants olfactory testing and neurological evaluation. This is an important early sign, but the next warning sign affects how your digestive system works, and it's often managed without investigating the underlying neurological cause. New onset constipation, especially severe constipation that doesn't respond to standard treatments, can be an early sign of Parkinson's disease. Why? Because Parkinson's affects the autonomic nervous system, which controls involuntary functions, including gut motility. Dopamine regulates gastrointestinal movement. In Parkinson's disease, as dopamine neurons die, gut function deteriorates. Constipation develops. This can appear years before motor symptoms. Why is this missed? Because constipation is common in older people. People and doctors assume it's dietary, medication related, or just normal aging. They don't investigate neurological causes. They recommend fiber fluids, stool softeners, laxatives. The constipation persists or only partially improves. Nobody thinks Parkinson's disease. I had a patient, Patricia, 72 years old. She developed severe constipation. She'd never had this problem before. She increased fiber, drank more water, tried over-the-counter stool softeners. Minimal improvement. She tried prescription laxatives. Still minimal improvement. She was miserable. Doctors investigated for obstruction thyroid problems, other causes. Nothing obvious. She managed it with aggressive laxative therapy for 2 years. Then she developed tremor and slowness, Parkinson's diagnosis. Once she started dopamine replacement therapy, her constipation actually improved significantly. The constipation wasn't a standalone problem, it was a symptom of Parkinson's disease. Early diagnosis would have explained the constipation, provided better management. So here's what you should know. New onset severe constipation that doesn't respond to standard interventions, especially in someone with other symptoms we're discussing, warrants Parkinson's screening. Don't just treat the constipation. Investigate neurological causes. But the next warning sign is movement related, and it's subtle enough that most people miss it for years. Bradykinesia means slowness of movement, and it's one of the hallmark motor symptoms of Parkinson's disease. But here's what's important. Bradykinesia appears early before tremor or rigidity. People notice they're moving slower than they used to. Their arm doesn't swing normally when they walk. Fine motor tasks become harder, buttoning buttons, zipping zippers, typing, writing. Movements are slow and deliberate. Why is this missed? Because people attribute it to age. I'm just moving slower as I get older. I'm not as spry as I used to be. I probably need to exercise more. They don't think Parkinson's disease, especially early on when slowness is subtle. But if you compare your movement to how you moved a year or two ago, if there's a noticeable difference, if movements that used to be automatic are now slow and deliberate, this warrants evaluation. I had a patient, James, 68 years old. His family noticed he was moving noticeably slower. His gait was different, shuffling less, arm swing. Fine motor tasks were taking longer. He was struggling with buttons, with handwriting, with typing. He attributed it to age and deconditioned fitness. His doctor didn't think it was significant. But a year later, tremor appeared. Parkinson's diagnosis. The bradykinesia that appeared a year before tremor was the actual first motor sign. Early detection at that first sign would have prompted earlier intervention. So here's what you should know. If you notice your movement is noticeably slower than it used to be, if fine motor tasks are harder, if your gait has changed, if arm swing is reduced, especially if these changes occurred over months rather than years, this warrants neurological evaluation. Don't dismiss it as normal aging. Seek medical assessment. But the final warning sign is the stiffness and rigidity that often accompanies Parkinson's. Muscle rigidity and stiffness, not pain but resistance to movement, is another hallmark Parkinson's symptom. Your muscles feel tight. Movement is restricted. In Parkinson's, this rigidity has a specific quality called cogwheel rigidity. When a doctor passively moves your arm or leg, they feel a jerky ratcheting resistance, as if moving a limb with gears inside. This is very specific to Parkinson's. Why is this missed? Because people attribute it to arthritis, to normal stiffness from aging to insufficient stretching or exercise. They don't realize it's neurological rigidity. They might try physical therapy, stretching, heat interventions that don't help neurological rigidity. I had a patient, Susan, 70 years old. She developed increasing stiffness, especially in her neck and shoulders. She couldn't turn her head as easily. She felt stiff in the mornings. She attributed it to arthritis and tried heat therapy, stretching, anti-inflammatory medication. Minimal improvement. A year later, she developed tremor and slowness, Parkinson's diagnosis. The rigidity that appeared a year before other symptoms was the actual first motor sign. Early detection at rigidity could have led to earlier diagnosis and treatment. So here's what you should know. If you develop stiffness and rigidity, especially a jerky ratcheting quality to the resistance when you move, mention it to your doctor. Request neurological evaluation. This is an important early sign. Here's what's critical to understand. Parkinson's disease has a very long preclinical phase. Before any obvious motor symptoms appear, years of pathological changes occur in the brain. Loss of smell might appear 15 to 20 years before diagnosis. REM, sleep behavior disorder, might appear 10 to 15 years before. Depression might appear 5 to 10 years before. These are the early warning signs. Then as more neurons die, motor symptoms appear. Tremor, bradykinesia, rigidity often cluster close together closer to the time of diagnosis. But by then, significant neurological damage has occurred. If you understand this timeline, you understand why recognizing early signs is so critical. If you have multiple of these signs, even if they're not the classic Parkinson's symptoms everyone knows about, you should seek medical evaluation. The more signs you have, the more likely early Parkinson's disease is present. And early diagnosis changes everything. Here's the truth. Parkinson's is a progressive disease. There is no cure, but there is treatment, and early treatment dramatically changes disease trajectory. Dopamine replacement therapy, medication that replaces the dopamine your brain is no longer producing, works best when started early, when there's still significant neurological function remaining. Starting treatment at sign onset versus diagnosis 5 years later means 5 years of better movement, better mood, better cognition, better independence. Some research even suggests that early intervention with neuroprotective agents might actually modify disease progression, not just treat symptoms. Early diagnosis is your window to optimize quality of life, preserve independence, potentially slow disease progression. Late diagnosis means missing this window. It means rapid deterioration, disability, cognitive decline, loss of independence. The difference is profound. If you recognize any of these 8 warning signs or a combination of them, here's what you should do. Step 1. Document your symptoms and when they started. Write down when you first noticed tremor or smell changes or sleep disturbances. Timeline is important for diagnosis. Step 2. Mention these symptoms to your primary care doctor. Be specific. I've noticed my handwriting has gotten noticeably smaller over the past 6 months. Not, I've got some symptoms. Specificity helps. Step 3. If your primary care doctor isn't concerned, don't accept that dismissal. Request a neurology referral. Early Parkinson's can be subtle. Not all primary care doctors are expert at recognizing it. A neurologist can perform specific testing. Step 4. The neurologist will do a clinical examination, ask detailed questions, possibly order MRI, possibly order a DAT scan, dopamine transporter imaging, which can help confirm Parkinson's diagnosis. Step 5. If Parkinson's is diagnosed, discuss treatment options with your neurologist. Many medications are available. Treatment plans are individualized. Step 6. If diagnosed, connect with Parkinson's organizations, support groups, resources. You're not alone. There are millions of people living well with Parkinson's. Step 7. Don't panic. Early diagnosis, early treatment, modern therapies. These all provide hope. You have options. Your life can still be good. Have you experienced any of these warning signs? Do you have Parkinson's diagnosis? I want to hear from you. Drop your story in the comments. What symptoms brought you to seek medical help? What warning signs did you experience? What would you tell someone just recognizing these symptoms? Ask me your questions. I read every single comment, and I often feature the best stories and questions in upcoming videos. You're part of a community of people recognizing Parkinson's early, seeking diagnosis and taking action. Your voice matters. Your experience matters. Your story might help someone else recognize their own symptoms and seek evaluation before disease advances. Let's recap the 8 early warning signs of Parkinson's disease. 1. Tremor resting. Tremor with pill-rolling quality. 2. Micrographia handwriting becomes noticeably smaller. 3. REM sleep behavior disorder acting out dreams during sleep. 4. Depression unexplained mood decline. 5. Loss of smell progressive olfactory dysfunction. 6. Constipation new onset treatment resistant. 7. Bradykinesia noticeable slowness of movement. 8. Rigidity muscle stiffness with jerky quality. These aren't normal aging. These aren't minor symptoms to dismiss. These are your nervous system signaling neurological disease. And here's what I want you to understand most deeply. Early recognition equals early diagnosis, equals early treatment, equals better outcomes. You have power here. If you recognize these signs, if you seek medical evaluation, if you get diagnosed early, you're changing your disease trajectory. You're choosing a path toward better quality of life, preserved independence, optimized treatment. You're not powerless. You have options. You have hope. Please, if you recognize any of these signs in yourself or in someone you love, don't dismiss them. Don't wait for worse symptoms to appear. Seek medical evaluation now. Early diagnosis could change everything. Before we finish, this video is for educational purposes. These warning signs warrant medical evaluation, but don't guarantee Parkinson's diagnosis. Only a neurologist can diagnose Parkinson's disease through clinical examination and possibly imaging. If you suspect Parkinson's, see your doctor immediately. Always consult a qualified healthcare professional about neurological concerns. This is not personal medical advice. If you want evidence-based senior health content every single day, information that could literally change your life, subscribe to this channel now and turn on notifications. I'm Dr. William. Thank you for watching. Your brain and nervous system are worth protecting.